introduction to Dr. Tan Lai Yong, but before that, can we have the slides up, please? So Dr. Tan Lai Yong is currently the fellow of the College of Alice and Peter Tan in the National University of Singapore. This morning I told him it's the School of Hogwarts in NUS. Amazing college, amazing concept. If any of you guys are ever going to be in NUS, you guys want to go to College of Alice and Peter Tan. Dr. Tan insists that I read this. I mean, to let you know that he was from Siglap Secondary School and then proceeded to Temasek Junior College. Upon graduation from NUS in 1985, Dr. Tan worked as a doctor in Singapore. And in 1996, he and his wife and one-year-old daughter moved to Yunnan, China, and joined a community development team. Over there in China, he worked in remote villages, addressing poverty and helped to care for orphans, disabled children, and leprosy-affected areas. In his 15 years, I said again, in his 15 years in Yunnan, he had to cycle about 30 kilometers daily, create innovative ways to teach health and hygiene to the different minority ethnic groups and villages, plan for surgery camps for cleft palate babies and other disabled people, and also initiated tree planting efforts that led to thousands of trees being planted to help raise farm income and also reduce soil erosion. As part of the China National Day celebration in 2004, Dr. Tan was given the Friendship Award for Foreign Experts at the Great Hall of the People in Beijing, an event that was graced by Premier Wen Jiabao. Dr. Tan was also given the Singapore International Foundation presented by Mr. Lee Hsien Loong and the 2005 Singapore Milk Fund. He has a very interesting TEDx presentation that you should check out. Without further ado, can I invite Dr. Tan on stage to share with us his perspective on the future of healthcare and medical. Dr. Tan.
Thank you. Very happy to be here. We can dim the lights. It's all Q&A. And Nazir, thank you for giving a systematic approach because I'm not. Okay. So we can dim the lights. This is about future. I'll show you the past. Okay, next slide. Who control? Okay. Let's read this together. 1, 2, 3. Just take some time to think about this. In healthcare, you will meet suffering. Right? In fact, in any sector, you'll meet suffering. When we talk about economic downturn, right? We talk about cycles, but in that cycle is tremendous suffering. Okay, so what do we do about suffering? Next, I'm with the College of Alice and Peter Tan. If you want to come and have breakfast, dinner, just give us a call. We can organize it. Term time, holiday time, eat Maggi noodle. Okay, next. Right, we do community engagement as our theme. Next. And I was privileged to live in Yunnan at the corner of, this is where I live, is here. For about, 10, 12, 14 years. It's a Thai-speaking part of Yunnan. 12 Pana, 1, 2, 3, 4, 5, 6, 7. Okay, 12 is 12 rice-growing areas. Okay. That's my son. He's now about your age. This one. Yeah. This morning at Singapore, they have this running race, right? What? SAA open. Everybody can go and pay, then go and run. So he's there running. I work with a community development team. There are some 26 different ethnic groups in Yunnan, okay, across the board. I work with the ideas of caring for the poor by sharing knowledge. We don't give out free things. Okay, no goodie bags, like, and loving people. So when you meet a mother with cleft palate babies, the first thing you tell the mother is, you're okay. Because a lot of people will whisper to her, say, you must have done something wrong, must have some sin, something terrible you did. That's why your babies come out like that. Okay, across Asia, you find this happening. Okay, so discussion, right? Healthcare. This lady lived 4 hours from my clinic. My clinic is just some wooden courtyard, okay? 4 hours away. Why did she come to this? Okay, first of all, what do you see? Okay, where are the mics? Just describe what you see. Okay, discuss among your table yourself, okay? List 10 things that you see in this picture. Okay, discuss. Okay. Where's my good friend Ibnu? Ibnu, not here already. Yeah, you are the mic chaperone. Okay, thank you.
Thank you, Doc.
Okay, red shirt. Okay, what do you see over there? Okay, here's the nearest mic. What do you see?
Okay.
Tell us. Describe. Your name, sir?
Hi, good morning. My name is Hakim.
Okay, Hakim.
So basically, based on what I can see, he or she may be suffering from.
Suffering is
It's a mild word.
no.
Nope.
How do you know she's suffering? Right. Okay. Never mind. What do you see?
Third degree burn.
Third degree
exposed
burn.
skin,
Okay.
yeah.
Next, pass the mic.
That was my answer, sir. Hi, my name is Fuad.
Okay.
From what I observe, I think she or he might be exposed to some kind of chemicals.
Chemicals. Okay. Oh, what do you see, Zul? Yes. Yes.
Exposed wound,
Exposed wound, some more.
apa? Wooden leg.
Wooden leg. Okay. Yes. Pinocchio. Yes.
Then apa lagi?
Sir.
Swell, swollen knees.
Swollen knees. Okay. Pass on the mic. Yes. Yes. What do you see?
I see someone who is hopeful to be cured and have an improved or better life
Okay.
since he's going to the clinic.
Okay. Yes. What do you see? Your name?
I'm Desmond.
Desmond. What do you see?
The knee is swollen and wounded.
Okay. You off it. You want me to go away already? Okay. Basically, I show this picture, and the more professional you are, the less you see. So the doctors will see me. They see a wound. They see inflammation. They see granulation. They see this and that. Okay. Only a kindergarten boy stood up and say, "Uncle, I see a wheelchair." Right? And when I ask the question, why come to this clinic? The boy will say, because she wants to walk. Okay, so very different perspective. So the doctors will say, come for cure the wound. Okay, so this lady was bitten by a dog 2 years ago. But this is Yunnan, people bite dog, dog bite people is part of the diet. Okay, it's no different, right? So I was curious, why come, you know? And she couldn't walk. So she had this wound for a long time. She never used the word suffering, you know. Okay, but she couldn't walk in the past couple of weeks. That's why she went to find a surgeon. The local surgeon in the hospital offered amputation. Why was she willing to accept amputation? Because she wanted to walk. Amputation means can put a artificial leg. So doctors are always saved by the nurse. Okay, my nurse told me that actually she was bitten by a dog 2 years ago, and in her ignorance, she took steroids, prednisolone. Steroids is like nuclear power. It works beautifully in the short term. It does terrible things in the long term. Put on weight, get diabetes, hypertension, reduce immunity, infection go up. Okay, right? So all these things happen. What is healthcare? What should we do about future healthcare? I tell you this story. My nurse told me this story, and I took a step back. Okay, I give you a clue. If healthcare is about prevention, what are some of the things you and I should be doing for prevention? Okay, for this situation. Okay, discuss. 2 minutes. Yeah. Yes, your group.
Cepatlah aku.
How come the mic come here? Okay, yes. Yeah, your name?
Azwan.
Azwan, what can we offer to prevent this situation happening again? Yes.
Education.
Education in terms of?
Medication.
Education in terms of medication. What do you go write poetry?
Like, I mean,
education, medication. In what way? Yes.
I mean, like, for the example that you give, that the situation is that she took in steroids causes all that harm. So, if it was told to her like, oh, the effects of the steroids, and she understands that there are other ways to solve this problem, then she might not even go for the steroids. But without that, then
okay, so that's very good, huh? Right, education about medication, right? Okay, next. Yes. Your name?
Hi, I'm Cao Xian. Yeah. It's Hila. Yeah, I guess it's more of like health promotion and yeah, education and letting people know what they can do and what are the outcomes if they take like so that I mean like patients can actually choose what they want. It's like they're given all the choices and the client has the patient has the chance to at least know what he's in for. Yeah, what are the options then? Yeah.
So, yes, Ibnu side. Yes. Okay, yes, your name?
Zaf.
Okay.
Include, include teaching medicine, yeah, effects of medicine in our education system.
Okay.
Since young, yeah.
So I just want to introduce you about healthcare, the whole spectrum. Yes.
To educate about alternative medication, instead of just basing on just drugs, we just teach them about organic medication like herbs.
Okay, so this is where my nurse saved me. Good, we stop here because after telling me that, she just took salt water, saline solution, and dressed the wound, stopped the steroids. After 3 months, this lady walked home. Amazing, right? Okay, so in the meantime, somebody must teach her physio, somebody must help her walk. Okay, but if you look at the whole spectrum again, there must be laws. Somebody must be writing the policy to say that selling steroid is wrong. So when you go to the shop owner and say, why you sell steroid? You say, I'm only selling steroid. The fella behind selling heroin, marijuana, worse. At least I'm not doing anything in this golden triangle area. I'm not selling ecstasy, I'm not selling amphetamine, I'm only selling steroids. Right? So, what to do? Can he go on to teach him to sell herbs? I say that, you sell steroids, America will never come and buy. But if you sell mushrooms, cordyceps, one day I was walking and the lady was showing some black mushrooms. I never passed Chinese before. Okay, that's why I tell you from Singapore Secondary School. Right, so I'm not sure they were speaking in tribal dialect what that mushroom was. And she was basically saying, literally, the pig dug this out. The pig dug this out. So what mushroom is that? Truffles. So I took a picture. I quickly, this is called medical, WhatsApp to my friend, the surgeon in Singapore. I say, what is this? He also said, truffles. How much? I said, this one, $10 per kilogram. He said, buy the whole truck. Right, he stopped his surgery. He said, this is good stuff, man. Know how much I pay now? Huh? So I say, but if you sell your steroids, it can never be globalized. But if you sell your truffles, it can be globalized. So education, organic things are going on. So today, I just want to introduce a very simple idea that when I sat down and talked to this lady, I realized that our definition of healthcare, even our understanding of suffering, need to be relooked. Okay, human beings can take a lot of suffering, but when they cannot function, now, whether it's emotional abuse, physical abuse, we will just carry on, and tahan and carry on. But when we cannot function, that's when we scream for help. So in the area of healthcare, whether it's mental, sexual abuse, hypertension, how far early can we go before somebody breaks down and cannot function? All right? So some thoughts about that. I think our time is up, right? Can you show this later? So in order to carry on, I think we need to plant deep and listen. I tell this story because there was a dam, and there was ITE team came. The villagers know already. They always ask which team coming. Okay, actually they don't know what is ITE or Polytechnic or SMU or NUS. They don't know. But when I tell them ITE coming, they say, okay, today they come, tomorrow they start work. The next team that come, I say NUS. They say, oh, NUS team coming. Today they come, they have 3-day meeting, 4th day they start work. You know what I mean? So the villagers all know. They say Polytechnic, what is it? This one Polytechnic somewhere in between, maybe 1-day meeting. Okay, SMU. I said, oh, SMU. 5-day meeting. Oh, no. Okay? So anyway, there was a dam. I asked this lady, this in the mountains, a village head woman. I said, we got teams coming, what can we do? Says, well, I know your CIP. Traditional, the build school, build toilet, build already, we cannot use. Okay? Right, because the wall like that, you know. They said, okay, never mind. So she brought me, she said, what we are poor. If you can, this dam is for agriculture, water. Water is a basis of health. Okay? Say if we can provide enough water, my farmers, my villagers can plant their own rice. Any high yield crops, beans, rice, all need more water. And then we can take care of ourselves. You can build the school, you can build the road, you can build the toilet, but then we still remain poor. Says, but somehow our dam, the reservoir has less and less water. How can we increase our water? I say, what happened? So walk with her. Just now I told you about a patient, now I told you about environmental health. I walk down the dam. It was a mud dam. And there was water. He says, but I said, what happened? He said, no. She said, I don't know what happened. Last time, this dam is mud dam, right? There were trees on the dam. But because we got a little bit richer, we bought motorbike. In order for the motorbike, the dam also become a bridge across the river. To cross, we cut down the trees. After cutting down the trees, the dam got less and less water. I don't understand why. She said, maybe the roots hold the mud together and now it leaks. So we have to add another layer of something to the dam to prevent the water from leaking. That was a story. So my answer is, you know, we need to see what is inside. Healthcare is about what is inside. Hospital buildings, all these are very important, but generally they still is what's on the outside. What is inside is, you can discuss what is inside. Values, staff morale, training, motivation, right? What is the motivation towards healthcare? And you really got to deep insights. And in her words, she says that, I think once we cut the trees, the dam leak because the roots are no longer there. So as you pursue your ideas going forward about healthcare, okay, part of it, I show you what's on the outside, what are things you do, but part of it, you have to look what is on the inside. Because the nature of healthcare in the next 50 years has to change. Because when I see somebody who is 45 years old, mild hypertension, mild diabetes, I'm 25 years too late. I should have started working on this guy when he was in JC. Okay, thank you for your time. Yeah.